Welcome to the Physician Associate Podcast.
Hello and welcome to the Physician Associate Podcast. My name is James. I have a bit of a confession to make. I absolutely love the University of East Anglia in Norwich. I spent almost 10 years there, first as an undergraduate doing my degree in biomedicine, then a master's degree in molecular medicine and PA studies at the Norwich Medical School as well. I've not been gone long, but I've also recently returned to UEA to start a postgraduate certificate in education so that I can teach PA students in the future. I'm delighted today to be joined by two people from UEA, Dr. Stephanie Howard-Wilshire, who is a doctor in psychology, and Professor Suzanne Linktvist, who is from the Centre for Interprofessional Learning and a teaching director for the Norwich Medical School. Hi, Stephanie. Hi, Suzanne. Welcome both.
Thank you.
Thank you.
The reason I wanted to get you on the podcast today was to talk about some really interesting research that you've done into physician associates in the workforce. How did that research come about?
My input to this project was that I, for many years, have been interested in working with interprofessional learning and working. And so I am director of something called the Centre for Interprofessional Practice. And so I have two roles. The other role is teaching director for Norwich Medical School. And we have this relatively new profession called physician associates. And I became very interested in the PA role because it was new. And because in my SIP role, I was wanting to do more research, I proposed that maybe we should do a project around the PAs and how the workforce welcomes them into the team and how they feel and how the others feel and support them. But I was delighted to find Stephanie, who is a research associate.
Okay. And could you just explain what the aims were, what you were looking into?
The aims of this study were to explore physician associate contribution to care within the secondary care setting, so within hospitals, and how the physician associates are actually integrated into multidisciplinary teams. The setting for the research were in 3 acute hospitals in Norfolk. So the participants we were seeking were all the PAs working in Norfolk, of which there's around about 20 at the time, all staff obviously working with PAs and all patients cared for by PAs. We decided to do a questionnaire and then follow up with some interviews.
We were asking both patients and PAs and people working with PAs. So I think the good thing about this study was that we had different perspectives. But I think Stephanie can take us through a little bit about the main findings, which ended up being quite different looking at the trusts in and around UEA.
The PAs themselves were 100% satisfied with their jobs. Most were happy or satisfied with their pre-registration training. PAs felt that they had time for patients and they could discuss their condition and their treatment, but only 66% were happy with the supervision and continuing development they received post-training. PAs felt they were trusted 100% by the multidisciplinary teams in which they worked, and they improved the efficacy and efficiency of the teams.
So on the whole, you found that PAs were quite satisfied with how they were working, but that there was room for development in things like their supervision and their CPD. Is that fair to say?
Yes, that is very fair to say. It was a little bit hit and miss across the region. Attending continuing personal development schemes was difficult in that they may not get time off work. It may not be deemed suitable for their role to go to a particular type of training. In some hospitals, PAs were encouraged to train with the junior doctors, but in others that was barred to them and they had to find other ways of developing their skills. But it's a two-way process. We also found that some of the PAs were finding junior doctors and nurses coming to them and asking them how to do certain tasks. And PAs felt they themselves trusted by the multidisciplinary teams that they worked in. They also felt valued by the teams, and they felt that they improved team effectiveness and contributed to the team and improved.
And in terms of looking at what the patients fed back to you, it seems like the headline is that most people didn't really know what a physician associate was before they met one.
When they first go into hospital, 93% of patients had no idea about a PA. But by the time they left, just over 50% knew what the role was. All patients themselves were strongly agreed that the PAs listened to their concerns, that the PAs explained what had to be done and why, and it was done in a patient-friendly way. And they felt they had confidence in the care that the PAs were giving, and they would be happy with the PAs to be involved in their care in the future. Virtually 100% across the board felt that PAs provided person-centred care, which is really important to patients when they go into hospital, I think.
That's really nice to hear. So when patients do meet a PA, the patients themselves are recognising that the quality of care is very good and they're happy to be seen by PAs. There's just obviously a piece of communication to come about explaining the role to the wider public.
Yes, most definitely, yes. That needs to be clarified. And I say it's not just patients, although obviously they're the ones more in the dark than staff, but a lot of staff are also in the dark. So it needs to be clarity across the board, across the country. But staff were happy for PAs to work independently. They felt that they could offer safe medical care, and they felt that they improved efficacy and efficiency of the team. Some staff wondered why there should be PAs in addition to junior doctors and advanced nurse practitioners. Others were very keen to support them and wanted them in place because they were so flexible and able to develop skills. Whereas if you train a junior doctor, then they may only be there for 6 months and then they go off again to somewhere else. One of the main findings was that PAs are there, provide continuity of care. So not only staff found it very, very helpful, but also patients, obviously, if they see the same face every day, then if they feel that there's something not quite right, then they're more likely to speak to the PA rather than just letting it go. That continuity of care is very important.
Even though we kind of, in some ways, before we did the project, perhaps guessed some of the results that we actually got, I think the fact that we could consolidate that truth, if you like, with some of the results. And like Stephanie says, what we did get was very clear to sort of help the trusts, I suppose, to know the importance of preparing any new profession coming in. We need to be clear about roles and responsibilities for a certain ward or for a certain team or for a certain setting. And I think that the leaders in terms of the organisation can help welcome the PA in this context. And I think we noticed that they did that in some places and in others perhaps not, which I think will change as a result of this project as well.
Actually, going on from that, James, that one of the things that did come out of the physician associate interviews most particularly was forging a role. Because they tend to be a generalist type of medic, they quite often found it difficult to actually find a position for themselves. The physician associate who may have been on the ward as a trainee would identify where they could have a specific role. Sometimes it was the staff who identified a situation where a PA could fill the position and help with the team. I suppose that is the difficulty with having a generalist type of medic, is how they can, develop this role and find that sort of niche for themselves.
But this could also, I suppose, be an opportunity, I think, because as the PAs might stay on and get to know the team, maybe they will sort of shape the role together. And I suppose that could be a dual responsibility, both from the PAs themselves asking for that to happen and for the team to helping make sure that happens. And depending on the setting, that role might be generalist. I'm just thinking that maybe with time as well, I think it's really exciting for PAs in the next, say, 5 years and beyond, obviously. I mean, I'm working with Audrey Gibbs, who is the course director locally for PAs, because, of course, we are hoping for the profession to be GMC registered by January 22. And that's quite soon, that's only months away. And maybe it'll be a little bit delayed, but there is no doubt that it's going to happen. And then, of course, they the profession will be able to prescribe and do the things that perhaps somehow has, been a little bit of a boundary or barrier for the profession to really feel embedded in some quarters. I think in some areas it's worked really well, but there has been a little bit of maybe possibly uncertainty about accountability and, what if something happens, patient safety, both from the PA's point of view and the, if you like, the other parts of the team. So I think the GMC registration will just really, really support and help the profession going forward. People will look at it more critically, wider. And so I think CPD opportunities, and also what came up in the study, the equity for CPD opportunities amongst different members of the staff. So there is no feeling of competition between certain professions about these opportunities in a hospital or primary care setting, wherever it might be. And also time, because 5 years ago, maybe nobody had even heard so much about physician associate here. And I think there is a good research stream following the identity of the PA and how that evolves over the next few years. And hopefully, grows and consolidates, because I think that looking at our study, there is just that sense of role, the role evolving, which is a good thing. But sometimes I'd like to know more about how the PAs themselves feel about that and what could help, because I suppose research, I think, is about doing it and understanding it, but it's also about then taking that back to the primary care setting or the trust or the training of PAs to help them. And I think if we can understand better what it is that PAs need, then I think that might help.
It's exciting times for the profession at the moment as well, isn't it? It has exploded, really. Even in the few years since I started training at UEA, it's unrecognisably changed. It's exciting. The future of research into PAs into the workforce, where do you see that going? And any ideas you have for sort of furthering your study and developing the body of literature around PAs?
Well, for me, it is, looking at my particular interest, which is interprofessional practice, there is always a discussion around professional identity. And some people talk about interprofessional identity, depending on who you are. I personally, being Swedish and being in England, I feel identity is one. You show your passport, you have an identity. You might be different in, if you're a PA, for example, you have a PA identity working as part of an interprofessional team. But I don't necessarily think you have different identities. So for me, a big research area is about identity, because that is important. It has so much to do with value and how teams operate together. And I also want to know where PAs, I've listened to team in primary care, for example, where it really, really works. And I want to understand, so what made that work? What was it? And can that ingredient, if you like, be used by other teams so we can share that best practice? And then for patients, of course, why do they need a PA? They do, but we need to, they also need to understand how they benefit from PAs. So I would like to extend that strand.
And what do you think, Stephanie? How might future research and studies into physician associates in the workforce be constructed?
There might be possibly a paired comparison, looking at similar wards, doing similar jobs, one with a PA and one without, to see how long it perhaps takes to do the clerking on the ward, and looking at patient care, what the patients feel, what staff feel, and how admission and discharge actually goes. Yeah, so that's looking at the added value that the PAs actually give to acute teams, giving them or encouraging them to be involved in the training that they require and being able to develop a professional process for development.
Yes, I think that's important, because I am curious as to how PAs evolve over time, what they need to feel excited about staying in their role. I'm not saying they wouldn't, but I'm just saying, what are they going to think about 5 years, 10 years, 15 years? What will they need, as it were? And at the moment, because it's quite new, although it's been in the States for much longer, but it's still different, I think. We need to understand what your profession needs, which might be similar to others, but it might be slightly different as well. So let's go back to what Stephanie just said. I think you need to be part of that development.
And if there are PAs that are listening to this podcast at the moment and thinking, this sounds great, I'm excited about the future of research into the PA workforce itself, is there any advice that the two of you would give to PAs that are interested in exploring research in their career?
To give them a basic grounding in what could be done and how, they would probably need to do some sort of training on research methods. But I think the main issue with all research is actually gaining funding to do it. I mean, PAs wouldn't really want to perhaps do it on the back of their day shift or whatever. So it'd be a matter of finding some funding to cover them to do the research, perhaps link up with people like us in the UEA to help and guide them along the way. But I think that'd be a fantastic opportunity. And I think it's being as they are on the ground, they'd be the ideal people to actually conduct research.
No, I would agree. I mean, there are some master's programs, for example, that could be done together with someone as well, but they're very clinically focused as part of the education that Stephanie alludes to. You will need to learn how to do it if you don't know already how to carry out research projects. And I suppose if it is about you, as in if you are a PA researching about PAs, then it's about knowing how you would deal with your potential bias, which you would naturally have for your own profession. And I'm not saying you couldn't do that, because of course you can, but you need to learn how to use that. But it could be other projects as well, like service improvements projects. And we have recently took on a previous graduate as our teaching staff. And I think that's not research, obviously, but it's really exciting, I think, when they want to come back and give back to new PAs and to get that going. And the PAs students love that because it makes it real.
Yes, that actually came out in the research as well, that some of the PAs felt that having role models and being trained by PAs would actually help their profession and their own development.
Absolutely. It's so important to have role models, to know that the profession's going to work and that people have been there and have done it first, that when you're a student, you can look up to them. To your point earlier, one of the things that always boggles my mind is there is an awful lot of development into drugs and therapeutics and what we do to patients. There is very comparatively little research into who does it to patients, in terms of research into people into the workforce, PAs in the workforce and that kind of thing. So I think it's quite an interesting and innovative idea to look at what sort of people need to be in the workforce and the impact that PAs can have.
No, definitely. And I also, I thought there, James, when you were talking about that, one thing that I also think that both all professions, but PAs as well can help is the prevention, because the prevention side of care is we don't do enough of that, and we need more on that. We need more education about why we need to eat properly and why we need to exercise more, like as part of the treatment that we give. So I know prescribing medicines are important to PAs, but I also think that they can help in the prevention bit, because that goes back to what Stephanie was talking about as well with this continuity.
Guys, this has been fantastic to speak to you about all of this. Thanks so much for joining me both.
Thank you for asking us to come here, James. I feel really privileged, and I feel really privileged to be in a medical school which has a physician associate program. And I'm very, very sort of supportive of finding ways to make sure that it goes well for those PAs going forward, but also to attract new ones coming to us, because I feel really, really proud of our PA course.
Yeah. And I must say I'm really pleased to have been involved in this research at cutting edge virtually, especially in Norfolk, regarding PAs. And it would be fantastic if we could continue this research along the ways that we've been talking about, and gaining cooperation with PAs and working with them to develop further research and gain the funding to do it. But yeah, so thanks ever so much for inviting us, James. It's been really great.
If people have heard this podcast episode and they're interested in talking to you about research and the ideas that we've been talking about, what's the best way for them to get in touch?
My email address, and I'll be pleased to hear from anybody who'd like to contribute or be involved in research. But obviously, as I said, it's the time and cost element that's important.
And you are more than welcome to contact me as well. And I'd be interested to hear from you about research projects, but also if it has anything to do with CPD or the course that we run, to make it better, if you have any ideas.
Thanks both, and I'll leave your contact details in the show notes below this episode so you can find them there. Thanks so much for listening. If you'd like to follow the PA Podcast on social media, we're at PA Podcast UK on Twitter and Facebook. I'm on Twitter too, at James Catton. Thanks again, and I hope to speak to you soon for the next episode.